It was during training for a long-distance charity bike trek that Kathy Schroeder started struggling to breathe.
That was part of my clue that, yes, something was definitely wrong. You're not going to jump to cancer.
Turned out it was cancer, stage 4 ovarian cancer.
So far, I'm considered NED, no evidence of disease, which is about the best you can get at this point.
But Kathy knows there's a good chance her cancer will return and that the same treatment may not work.
As a clinician, I have no reliable way to predict which chemotherapy is going to work.
Researchers at the Mayo Clinic are working to take some of that guesswork out of cancer therapy by creating a so-called cancer avatar.
We are essentially creating another version of the patient's tumor, just in a different location. In this case, it's going to be in a mouse.
The key here is that it is the patient's own tumor in the avatar. Every cancer is different, and so by carefully monitoring which drugs shrink the cancer in the animal, they have a good idea what will work should it return in the patient.
Perhaps we can predict which therapy will work the best for the patient and thus spare her the side effects and the lost time of ineffective therapy.
Renee Molesky is 2 years into her survival story. She was just the second patient in the country to have her tumor turned into an avatar.
This avatar thing is hopeful because they're not just practicing on just any cancer, but they're practicing on my tumor, what responds.
Kathy Schroeder knows she's facing an uncertain future, but the avatar gives her hope.
This probably will happen eventually, but I have options.
The important concept here is that no two cancers are the same, which means that the same drugs that work on one person's breast cancer, for example, may not work on another patient's. That's why the avatar is valuable. It's specific to that patient. It's really the beginning of real, truly personalized medicine.
Incredibly valuable, as you said.
It sure is, yeah.